On Friday, a blessing took place together with the announcement of OSF's launch of its Resilient Healing Program, specifically designed to help survivors of sexual assault. And the program will open in late June, and it's going to be offered through hospitals in Mendota and Ottawa, but certainly open to everyone in the region. The Peoria-based healthcare organization says that resilient healing is all about helping survivors recover from trauma through hope and a renewed commitment to recovery beyond the traumatic event in the first couple of days. Beyond that, 18 OSF sexual assault nurse examiners, SANE, are in place to help survivors from OSF facilities and around the area. You're going to hear them in this video talk about SANE, and that's what that means. Their field of focus allows them to perform forensic exams in the emergency departments of those facilities. And then this program will then extend or offer extended care for people for several months beyond the initial trauma. And the program was one of the ideas of OSF SANE nurse Tasha Arteaga 2 years ago. And since then, she has trained people for this program. And today, you're going to see parts of Friday's blessing and announcement from OSF St. Paul and Mendota. And that's going to include remarks from Tasha and an interview with her. And that's going to be in addition to some what I thought were some really solid remarks, too. You're also going to see carvings that also were blessed on Friday. And these are images of 11-year-old Maria Goretti, an Italian girl who for a while was the youngest person to be made a saint. And the carvings are going to be reminding people of the mission of the program in those facilities. You'll hear more about that too. Tom's Take is sponsored by my friend Kathleen Wayland of Wayland Financial at 128 Buckland in LaSalle. Here it is.
The effects of sexual assault are profound and far-reaching. Physically, survivors may experience injuries that require immediate care, as well as ongoing health concerns that surface long after the assault. Emotionally and mentally, they often battle feelings of shame, anxiety, and depression, and post-traumatic stress. The resulting trauma can disrupt every element of their life, from personal relationships to professional endeavors. This aftermath requires a comprehensive approach to healing that includes specialized, trauma-informed follow-up care. Trauma-informed means recognizing the impact of trauma and providing care that prioritizes safety, trust, and empowerment in a compassionate and respectful manner to avoid re-traumatization. While our emergency department provides immediate care and medical forensic examinations, OSF Resilient Healing will fill the gap of ongoing treatment. Survivors, both adults and children, will benefit from continuous medical follow-up and mental health support delivered through a single provider.
OSF Resilient Healing is the first program of its kind in the state of Illinois. As Tasha explained, survivors can already receive acute care and a forensic examination at our OSF hospital emergency departments in Ottawa and Mendota immediately following an assault. But this program will go so much further than that. It will provide the ongoing physical, emotional, mental, and forensic services and referrals that so many survivors desperately need, but so few of them receive. After the initial emergency care, less than 5% of survivors seek follow-up care. Our goal with OSF Resilient Healing is to greatly increase that number in the I-80 region. This service is also a testament to the I-80 OSF regional model of care. There are so many services that our communities really depend on that simply wouldn't be available if OSF tried to provide each and every one of them at all of our hospitals. We just wouldn't have the volume of patients necessary to be able to sustain such a siloed system of care or the clinicians to provide those services everywhere. But through our regional approach, we're able to attain that volume and provide care close to home by working together to cover the entire region. This is exactly what we're going to do with the OSF Resilient Healing. With one treatment center in Mendota and one in Ottawa, we'll be able to cover the entire I-80 region. Our hope and prayer are that this program will succeed in providing healing when it's needed most, and that we will then be able to duplicate it at other treatment centers across our ministry in an innovative approach.
What Zach just uncovered are carvings of Saint Maria Goretti, who was a young girl in Italy, one of the youngest ever to be beatified and named a saint in the Catholic Church. She was 11 years old when she was murdered. St. Maria Goretti proved forgiveness was possible in any situation, and she proved that forgiveness transforms the world. She was born into a poor family. Her father had died when she was 9 years old. They could not afford their own home, so they shared a house with another family, the Serenellis. And on July 5th, 1902, Alessandro Serenelli, who was a 20-year-old young man that lived in the house, attacked Maria with the intention to rape her. She refused, and he threatened to kill her. According to testimony, she fought him and screamed, "No, it is a sin. God does not want it." Then he stabbed her. Her mother found her on the floor and took her to the nearest hospital. When she went to the emergency room for emergency surgery, it became clear that she wasn't going to make it. She woke up during the surgery, and one of the doctors said to her, "Maria, think of me in paradise." Maria answered, "I will gladly think of you." From her hospital bed, she prayed that her mother would be all right. And then she did the unthinkable. She forgave the young man who attacked her. She said, "For the love of Jesus, I forgive him, and I want him to be with me in paradise." And then she passed away. Alessandro would have received life in prison had he been 21, but he hadn't been 21 yet. He was sentenced to 30 years. He was bitter and not sorry for what he had done, until one day, about 11 years later, Maria appeared to him in a vision. Dressed all in white, he realized it was Maria. She brought him lilies, but he didn't want to take them. Maria urged him to take them, and finally he did. When he took each lily, transformed into a white flame. Maria repeated her forgiveness for him and then disappeared. Alessandro's life changed that day. He repented, turned back to God, and became a model prisoner. After he finished his jail term, he went to the house of Maria's mother and begged her forgiveness. She told him that if Maria had forgiven him, then she had to forgive him also. And so she did. Well, he went on to become a Franciscan lay brother, and he was present at the Vatican when Pope Pius XII canonized Maria as a saint. Forgiveness transforms lives. Forgiveness transforms the world. Our capacity to forgive is greater than any of us might know.
How did you have this idea to do this?
Well, so I've been a St. nurse since 2019, and just when I started as a St. nurse, it just felt right. I've had other opportunities and things that I could have done, but this is just something that has spoken to me. And the more that I've been involved and the more individuals I've cared for, but also the individuals I've been able to train and teach and watch them grow into becoming just phenomenal providers to care for this population, I can't explain it. It's just a calling. So by caring for those individuals, but then not knowing what happens to them afterward, it just kind of was interesting to me. I wanted to see for myself, like, what happens to them? Where do they go? And so I started doing research, and it's just, there's really not follow-up for them. And there's so many reasons, but one of the biggest things is the stigma that they're not believed, right? And it's hard to tell your story not knowing if you're going to be believed, but most of the time they're not. So I wanted to change that.
How does it feel to know that you've originated something that is going to be so helpful to so many people? Having the idea it was just such a big step.
Yeah. Having that idea, just with that hope that I'm going to be able to really help people move move from this horrible thing and just help them through the rest of their lives, hopefully making it the best quality that they can have without this dark shadow over them.
Sounds like OSF also backed you 100% and gave you every the resources you need to get it going. And now they're really proud of you for this.
And OSF aside, it's not just the OSF, it's the individuals here. I couldn't have asked for a better team, and they've, even before OSF, even before any of the stuff I've been doing, there are some amazing leaders here that just want to build others up, and that's really neat to see.
Now, besides the obvious benefit of offering people crucial help just when they need it and for an extended period afterward, I also appreciate this program for how it started. I mean, one caring worker, OSF calls their workers, their employees, mission partners. One mission partner had a question, and she researched it, thought of a need and how it could be addressed. And then she was not only enabled, but encouraged by her employer to make it happen. And now, how many people are going to benefit in some way from her idea and her work? And then the work of all the people she's helped train. That's the spirit and the optimism that I think is always ready to be unleashed here, and certainly that's what we talk about in the mornings. Thanks to Kathleen Wayland of Wayland Financial at 128 Buckland in LaSalle for making this weekend reset possible. Enjoy your week.